I'm going to make sure you have an understanding of what thermography is, what it's not, how it's done. We'll kind of show you the probes that we use to be able to do the thermography testing. And then I'll be able to answer some questions, like some common Q&A. There's some things you do before the appointment that you want to prepare your body before the appointment. So I'll go through that as well. So we're going to cover a good amount of information in a little bit of time, and at the end you'll be able to ask some questions, okay? I have a ton of amazing testimonies. We've been doing thermography for quite a few years. We've had our own unit for the last 2 years, but I used to refer out, and I had a couple friends that did it. And it got to the point where my staff was like, no, we need to have it in the office. So they insisted, and we did what they asked. So we got a machine here, and we've been doing it for a little over 2 years now, and it's just been amazing. The results that we have seen, we have used it for people who are looking for, to identify health-related issues, to identify the source of the health-related issue, and also to use it sort of as a tool to track their progress on the plan we've put them on, So that's been really exciting. The other thing, you guys know that we do blood and urine testing, metabolics testing. We have a blood and urine testing, so what's really been cool to me is that, our office is all about taking x-rays, making sure that the nerve supply is functioning at its optimum level so your body can heal. This is one test, right, the x-ray. The blood and the urine is another test. The thermography is another test. They're all a beautiful snapshot of how your body is healing. And what's been really cool is to be able to see how they complement each other. Like one is confirmation of the other, is a confirmation of the other. And then you can get a really good strategy so that you can prevent disease. And in many cases, people who come in here who might have cancer or some other disease, they're able to track their progress and the action steps that they've taken. So it's been a really awesome tool that I have loved to be able to use and see great results in the office here. So we'll cover a couple more of those testimonies. I have some pre and post thermographies I'll show you as we go throughout the program here tonight. But I wanted to share with you guys before we get started, I'm not sure how many of you know my story, or probably knows my story, how I became a chiropractor in the first place. Many people know Dr. David's story, but it dawned on me that a lot of people don't even know my story. And I think because I graduated first and he came in after, that I kind of assumed everybody kind of knew. And I realized people just had no idea. But I actually got started, my chiropractic journey kind of began when I was 16. And I was in junior in high school. And I got a phone call when I was in school. And they pulled me out of the classroom, and the news was, your dad has been in a terrible car accident. And so you can imagine, like I don't know a lot of information, I just know that you're pulling me out of the classroom, my dad's been in a terrible car accident. And then they proceed to tell me that my dad had flipped his truck, and they had to cut the cab off the truck, and they had to get him out of the truck and care flight him in a helicopter to the hospital. So here I am at the school, kind of freaking out, thinking, is he alive? Like, what's going on? So I actually get to the hospital, and my dad was pretty banged up from the car accident that he was in, but the good news is that he was alive. So it was, panic, and then, okay, he's alive. And so when we finally got him out of the hospital, they actually, he had a lot of pain. He was having a lot of pain, injury from the car accident. And so he kept, for a couple weeks after the accident, he was going back and forth to the hospital and to the doctors, and they're like, we don't know what to do with you. And in fact, the very last appointment that we took him in, the doctor's response was, it's got to be all in your head. Like, I know I don't know what's going on, but it's got to be all in your head. So they end up not sending my dad to a chiropractor. They definitely did not send him to a chiropractor, but they said it's all in his head, so they end up prescribing him an antidepressant. And so they prescribed him Prozac. So my dad comes home, and now he's taking Prozac, and about a week and a half later, he actually committed suicide in our home that I grew up in. And now that is not my dad. That was not my dad. Like, I fully know that that's not something my dad would ever have done. It was definitely because of the pharmaceutical, what happened to him. And so that journey led me to go, you know what, I don't ever want to let that happen to anybody else. And that's really why my husband and I do what we do, is because we want to make sure we get the truth out there, give people the answers, give people hope, really, that there's another way to be able to do things. And we believe that if you follow the things that we teach here with the 5 essentials, and you live it, no one's perfect, but you commit to taking action steps for each of those 5 essentials, that there's really not anything that your body can't heal from or prevent from happening. And so that's really kind of my story, like how I, came to do what I do and why I'm so passionate about what I do. And so we will get into thermography right now, and kind of why thermography, what was the big picture, why did we start doing it, like what does thermography do? And so one of the things about thermography, how it's different than maybe an MRI or a CT scan, those are anatomical tests. So when you get an MRI and a CT test, it's really sort of a snapshot of your anatomy. What thermography is really a snapshot of your function. It's a functional test. It's really an indication of, hey, how are my organs doing? How is the liver and the stomach and the thyroid, like how is all that doing? Rather than like a snapshot, anatomical snapshot, it's more of a functional test. And so that's really an important difference with that. Now some of the reasons, it got started 30 years ago. We started it in Europe, actually, is when the research started coming out on thermography. And really it's a functional test to track how your autonomic nervous system is and your blood flow responses to your organs. That's also a nice difference from some of these other tests that are out there. And some of the tests, that what it's good for would be female, breast health, men's prostate. It's not just for females, for men as well. I probably have 1/3 of my tests that we do are men. So it's not just females. I think a lot of times people think it's just for breast health. It's actually not just for breast health. Thyroid abnormalities, cancers, and inflammation, all those things. And again, it's a tool used for early detection. I have been able to see that someone 10 years out will develop cancer in a certain organ long before it shows up on a thermography. That's pretty powerful to be able to have early detection. Also, to identify the root cause of the illness, so let's say we see a spot in the breast. Maybe the root cause is not necessarily the breast. Maybe the root cause is from the neck. Subluxation in the neck. You lose nerve supply to your breast. We can see that root cause. I actually even found one lady who she had a spot on her breast. She came to me and she's like, I've got this lump on my breast, and we did a thermography. And her cause, we found a tooth infected. Really nasty infection in one of her teeth. That tooth infection actually leached down into the breast tissue, so the infection was hanging out in the breast. But the cause of the infection was not the breast itself, it was actually a tooth. When she went to the dentist and they identified the tooth, they were able to fix and heal the tooth, and then the breast healed. So that would have been a case where she would have gone in, maybe had a biopsy and taken the breast off, and that wasn't even the cause. The root cause of it was actually the infection in the tooth. And it's been such an eye-opening experience doing thermography, because to find the cause of something that doesn't even seem to be related it's just so, what? Who would have thought it was her tooth? Like, it never would have come out. And then in addition, to guide and monitor treatment, I just finished doing a thermography on a patient who she has had breast cancer, and we did her thermography. We started her on all these protocols that we're doing in the office, and 3 months later, this patient had some pretty serious things going on with her. And after 3 months of her starting the protocol and taking the right vitamins, eating the right food, making sure she's getting her right adjustments, she's juicing, she's doing all the things that we teach here in the office, we use the thermography as a tool to see how she's doing. And what was really awesome is that the 3 month later, her thermography, her thyroid had completely cleared up. It was on fire, major issues, that thyroid completely cleared up. The other area was her digestive system was in really bad shape, and 3 months later, completely clear. So we're able to see, all right, that stuff's kind of cleared up, but what did show up was that her lymphatic system was really in bad shape. And so that is showing and guiding us that, you know what, and one of my questions to her was, do you sweat when you work out? No, I don't sweat. I'm like, okay, well, we have to sweat. Like, you have to get your lymphatics moving. You have to dump toxins or they're going to stay in your body. And so that was one of our major action steps. We actually talked about getting far infrared sauna, her getting a unit in her house so that she can sit in it. I mean, rather spend the money on that than all this other expensive poisons that are actually ending up, hurting her. She's actually spending her money on broccoli and, sauna, and she's spending her money on vitamins and all these wonderful things. And you can see through the thermography how it's showing the progress and her body is healing. We can also see what parts leveled out and what part now we need to focus on next. Like, it's a really awesome tool for us to be able to see that. Now, when you do the thermography, can you see all the points on this person right here? Those are all the points that we measure. Actually, there's a few on the back as well. And so there's over 100 points that we use when we scan. And what you do, like I said, it's a functional test. So I can see all these different organs, if your pancreas, your gallbladder, your stomach, your intestines. We can see your ovaries, your female organs, your kidneys, all those things just by doing the test with the probes. Now I'll show you one thing before we get into, and I kind of show you actually what the probe looks like. Have you guys seen this article? Did you guys see this in Time Magazine? It was actually, I think in October. I think it was October's issue. But the research coming out, what if I decide to just do nothing, has been pretty powerful. People are really starting to see that, you know what, if I decide not to, because some of the devastating things that are happening to people, women now, when they go in and get these mammographies done, is they're actually finding between 57 and 73% of ladies are actually getting a false positive. So a false positive leads to what? I mean, what would your next step be? Right? You would get a biopsy, right? Many times that's kind of where they go next. So you go in and you do a biopsy. When you biopsy a tissue that has cancer, all you do is you set it up for spread, right? So you set up an issue that was a false positive, now you damage the breast tissue, and see how that pattern kind of, it goes in a really negative direction. In addition, they found that 1.3 million women are actually getting misdiagnosed with cancer, 1.3 million every year. So a lot of women, because of these stats, they're just deciding to do nothing, and they're finding, they did a 20-year research study, that they're finding these women are actually better off to do nothing, because when they get misdiagnosed and they get false positives, they're actually healthier to do nothing. What I like is not the whole do nothing. I like to do things like these scans that we do, like thermography, because it's not invasive. It doesn't hurt, the body tissue at all. It doesn't cause something to spread that maybe is encased and your body's trying to deal with it safely. It's actually a real natural way of doing things. But those are some of the stats out there. Now, as far as mammography, they found that it's equivalent to 1,000 chest x-rays every time you get a mammography done. And the mammography, what happens is when they put the breast inside the mammogram, they actually squish it down, and it actually can cause a spreading of cancer cells when they squish the breast down. And so that's the reason why in Switzerland, they have just decided to completely stop doing mammography altogether, because they found what the damage is that's going on with doing actually mammography, and the overall, it's not even reducing the death rate or disease, but it's actually increasing overdiagnosis and false positives. Like, these people are actually really focusing on the person, rather than the almighty dollars. That's pretty powerful. Now, if you get a mammography every year, for 10 years, you're increasing at the end of 10 years, 10% increase in breast cancer just from doing the mammography. So you want to look at some other alternatives rather than increasing your risk, and that's what thermography is actually really good for. Now see the colors on there? That's what we're looking for, and I'll kind of show you on another picture here. You can kind of see some of the color differences. What it's measuring is the temperature changes and the color differences, and I alert you when I go over the results, like, okay, see the color differences here? This one's a problem, this one's not a problem. And it kind of helps us to point to the area of what we need to focus on when we do the test. Now you can see here before treatment and then 10 weeks after treatment. So before treatment, can you see the color changes, how everything's nice and green here? And on this side you can see everything's, to me, kind of like angry, like a red, angry kind of color. 10 weeks later, you get somebody, get them adjusted, you get them eating good, you get them exercising where they're actually sweating rather than keeping all the toxins in. And then you follow up with this beautiful test 10 weeks later, and it's amazing the changes that you can see. Now, the test is actually 20 minutes. It's only a 20-minute test. You want to allow yourself about an hour for the test. You'll come in, and I'll prepare you kind of some of the preparation. We'll cover some of the preparation stuff for the test. Well, allow yourself about an hour, and what you're doing is you're getting scanned twice. The probe actually looks like this. This right here is the end that will touch your skin, so it's a very light touch on all those different points that you saw on the page prior. That's how light it is. So it touches all those points. And like I showed you here, the breast, ovaries, uterus, heart, thyroid, teeth, and all your teeth, not just one. Like it tests every single tooth so you can identify which tooth may be infected or may be a problem. Lymphatics, sinus, colon. It's funny, I had a patient, I did her thermography, and she goes, her thermography was going over her results, and she goes, well, I don't have any sinus problems. I don't have anything. And it came back and it was like, sinus was like, bad shape, like really serious things going on in sinus. 2 weeks goes by and I see her in the office and she goes, that thermography was right. Like she's just all flared up. She was snotty and her sinuses were all really bad. She's like, that thermography was right. I'm like, that's because it sees things long before. It can be really in the cell, but maybe not necessarily expressing itself. And so in her case, it was something as simple as a sinus. What I like is when it catches something more complicated or serious, like cancer, It may be in the cell and not necessarily expressing itself, because it's so sensitive. It tests things long before they show up. And I thought that was pretty interesting. Like she was like not really kind of believing it, and then everything that we talked about started happening on her test, or she started actually experiencing the symptoms. Colon, then kidney, prostate, liver. I had a patient who came in, a man, and he came in and he was worried. He had prostate cancer, and he was just really freaking out, having a lot of pain in his testicles, like all these symptoms that he just thought, oh gosh, I have to have cancer. And when we did his scan, we found out that he had some serious issues in his digestive system, and he also had a tooth issue that he actually told me months prior that he had been really battling a really bad tooth infection. And so I think the doctor had pulled the tooth out, and then the gums were all infected, and he was really battling it. So what happened was that had spread to the digestive system, and then the digestive system had spread into the testicular. Inflammation showed up there, and he was having testicular pain. So the problem wasn't his testicles. The problem was, the tooth is where the original cause, and then it spread to the gut. It was pretty powerful. And then we got him started on a protocol, and then a week goes by, he comes in, he's like, Doc, I'm so much better. I'm feeling so much better. Just that relief and the peace of mind also plays a big role, So, pancreas, liver, gallbladder, small intestine, and spinal column, those are all areas. It's amazing how many times I find, subluxation. Like we can see exactly the area of the spine associated with the issue that's showing up as far as the organ is concerned. Because nervous system, the spinal column shows up in several places, or has the ability to show up in several places. So it's amazing how we can see, how's your neck look? And then we look at the x-rays and we can kind of see, what things we need to tighten up and what we need to work on. So if you move into the tooth, is your dentistry affecting your health? So you can see here all the teeth. Has any of you had a thermography done? Many of you? Okay. So the probe you'll put on every single tooth, and you can see which tooth actually is infected. And what I do is I actually tell patients to take this with you to your dentist. Next time you go in and have a tooth cleaning, take it in and have them look and make sure that the gums look good. Sometimes you'll find that there will be a toxic tooth. For example, maybe 21 and 20 are toxic, like it says dental toxicity, and it's spreading an infection through the rest of the teeth toward the right-hand side. So many times the source is actually creating issues in other teeth. And so I tell people just take that to your dentist and have them take a look at all the gums, make sure they're good. I have one patient that we're dealing with right now who she had breast cancer, and she's got 2 really bad infected teeth. Like she's going to have, she had a root canal, and the root is actually all infected, and so she's going to have both of those teeth pulled and then have an implant done. But it's peace of mind knowing that that was a major cause for her, you know, in moving forward. Now here's a before and after. If you look at the left-hand side, this is sort of like a picture of what's going on with the breast. And what's interesting is you can see in this section right here, these words right there, and there's little check marks. Can you guys see the check marks from where you're at? So the little check marks, the thermography test says if there are more than 5 check marks, then this is pretty serious situation and probably and potentially could be cancer to the breast. Okay? If there are 5 or less, then we're in an okay range, and you probably could get tested again, you know, in 6 months to a year, and that would be fine, just sort of like a maintenance type thing. In this case, we could see a couple spots. For example, it tells you, it's talking about, for example, the tonsils and the lymph was blocked, the liver was blocked, and then there was also the breast was elevated, some different spots, different temperature changes from right to left. And then what's also powerful is, see the signature engravings for the breast dysfunction down here, this little color chart? Red is angry, you know, severe, orange is moderate, and then yellow is minimal, and blue is optimal. It'll give you a legend over here on the left-hand side and let you know what area is really the biggest issue. So if you look at all the reds on there from where you're sitting, that's showing inflammation in the breast tissue. It's also showing lymphatic load, which is in the orange, and then a distant related focus. So according to this particular test, the distant related focus may be in the digestive system. We would have seen that previously in some of the other parts of the scan. And then also a breast block spot, okay? You take this patient here and you go through the 5 essentials. So I pick through each of these 5 essentials, and I make sure we have a solid plan for each one of these 5 essentials, and we get really specific on, like, if it's lymphatics, the person doesn't sweat, and maybe they can't sweat, then we send them to their gym and, you know, do the sauna. We have to make sure that they're sweating. Skin brushing, get in a hot shower, make sure you're dumping toxins. Like, we do some really specific things to be able to get things, your body to be able to dump toxins. And so what we did with this one is did that, and then after the therapies, we went in and did another retest. You can see here on the retest, look at how much better just 3 months later. We've got all the red is almost gone. We've got 1 spot left that we're still working on. The orange is gone, and the red one up here is gone. And you can see there's only 4 spots marked off right there. So it's a nice indicator to be able to kind of point to, okay, we did it. We did really good with what we did. Now let's maintain it. And then, you know, the distant related spot on this one was digestive. So we still had some parasites and some bacteria and some things we still need to work on in the gut. And so we can put you on a plan, you know, parasite detox or a bacterial cleanse and things like that. And then the body can heal. But you can see it's a beautiful way to be able to test before and after, okay? Now when you come in for the test, a couple things to prepare for the test. You're going to come in to the appointment wearing loose, comfortable clothing. You want to be comfortable. And then you're going to wear a long-sleeved button-up shirt, long pants, even if it's hot outside. You're gonna not wear a bra, or maybe at least remove it 15 minutes prior to the test, because you don't want any temperature, heat, hot, tight clothing, because that's gonna affect temperature, right? You're not gonna take a shower the morning of. You're gonna do it the night before. Don't do any body sprays or lotions and things like that, because that affects temperature, right? We don't want to do anything that affects the temperature. Makeup. You're not going to drink coffee or caffeinated beverages or smoke, the morning before the test. And the tests are only done in the morning. Like, we only do them through 1 o'clock as the last appointment time, because your body temperature goes up later in the evening, right? So we do it only during the morning times. You're not going to exercise, obviously, the morning of. If you feel like you're getting sick the day of the test, or day before, then you just want to reschedule the test, because your body temperature is going to change, right? You might have a fever or something like that. As far as dentistry, we want to make sure we haven't had any work done on our teeth at least 3 days prior to the appointment. And menstrual cycle, we want to make sure that we're not on that the first 2 days for that. Come 15 to 20 minutes before the appointment. Remove your glasses. Even glasses have little pressure points, and we're going to be doing pressure points on your face. So we want to make sure those off. And cell phones. Cell phones affect, the temperature and your frequency of your organ cells and tissues. So we want to make sure those are out of the room when we're doing the test. And then don't drink alcohol 24 hours prior to the test. So those are really kind of something. We give these to people, but just kind of gives you kind of an idea of what you want to do before the test. Go ahead.
What about breakfast?
For breakfast, it's a light, I'll tell you exactly what it says. Come hydrated. Drink 12 to 16 ounces of water a half hour to 2 hours before the test. And then breakfast, I had it and it just escaped me. Give me a second. A light breakfast is acceptable, but nothing piping hot. So no hot soup.
So I could have my yogurt.
Yeah, you can have your yogurt. So light breakfast, yeah, it's perfect. Perfect. But I had soup at lunch today and I was burning up, so that would not be something you want to do before the test. Okay, the last thing would be just questions and answers. I feel like you guys have asked questions. Anybody else have any questions before we wrap up about the test?
You check for eyes.
Does the scan, would the probes go on your eyes? No. Mm-mm. Nope. Nope. Good question. Anything else?
So are most of the probes just torso area and face?
So when you come in, you'll disrobe down you'll do 2 tests. You'll come in and you gotta get acclimated to the temperature in the room. It's kind of cold in the room. We keep it cold because we want to make sure the test is accurate. Your body temperature isn't hotter than it needs to be, so it throws the test off. So the room is probably around 70 degrees. And then what you'll do is you'll disrobe down to your underwear. And then we'll take your test, your measurements, and all those 100 points that you saw on there. And then we'll leave the room and let you hang out in the room. And you want to make sure you're not, putting anything in your pocket, or you're not exercising in the room when you're just kind of resting and being peaceful and, looking at a magazine. You don't want to be touching your face. You don't want to be doing anything like that. And then we come back in and we do the test again, 2 scans, so we can compare the points. And then that's it. That's how simple the test is.
But how long does it take?
It takes about 20 minutes for the test, but you should plan on about an hour and give yourself a little bit of time, because you have some paperwork to fill out, before the test, and you can take the paperwork home with you. But you have some paperwork, and you got to get your body, like I said, acclimated to the temperature. That's really it. It's just the temperature and the room, making sure you're acclimated to it. It's a good question.
How often is it recommended to do this test?
I think thermography is a really good test for you to do yearly, sort of like you do your x-rays. Get your thermography done yearly. Unless we found something, then I might do it a little more often. But really it's sort of like a yearly checkup, to see where you're at. That's also what I say for the metabolics testing. Once you've started, eating really good and started the advanced plan, you're doing really well. What I recommend for metabolics, the blood and the urine test, is to do that once a year too. Because you get exposed to stuff. You might get food poisoning and you don't know you're carrying critters around. You might get exposed to something, your hormones change, your body just changes. And you might get exposed to some toxins, so that's why it's a good measuring stick to be able to see how you're doing. Okay, good.
So it's
Anybody
part
else?
of the whole plan, the plan starts with this one, or it's included in the, you know,
Which plan?
The 5 essentials
The thermography is really a scan of how am I doing in that area. It's not necessarily part of, it's just sort of a separate scan. Yeah. Yeah, it's been a long time.
Yeah.
Yeah.
Well, I probably, when I come back, I probably will have to.
Yeah, you want to come in for you, where you would start is you would come in and get your x-rays done. Let's just see how you've been the past few years and compare, you know, make sure there's nothing new going on. And then we get you started with your spinal correction. And then from there, we work on making sure you're eating good and giving you a whole 5 essential plan. And then from there, you can do thermography. I have had people come in the door and just get thermography first. But I think for you, that would be a good way for you to start, you know. Yeah. Any other questions? Is this helpful? Okay, good. Awesome. I'll be here if you have any questions afterwards.
So people can come in the door and get the thermography?
Yes, I have had lots of people come to me just to do the thermography. And so you don't just have to, you know, be a patient already. You know, you could be someone who's never been a patient and comes in and has it done. I have doctors that send people to me and I'll do their thermography, I'll do their interpretation, and then I'll send them back to their doctor. So it just depends, but I do have people that come in just from that. Yeah.
Do you have any thermography patients where their cost is covered by the insurance?
I have not had that yet, but I did hear some good news. I think that is something in the works coming up next year, that it's definitely become more accepted. But I think a lot of insurance things are going to change next year. I haven't had it yet though. But I did hear, like I said, positive news. I think there is something moving in the works for next year on that. Yeah, good question. All right, guys. Thank you for coming.